Dental anxiety, we see it every day. Even I get anxious, to be honest, when I'm in the chair and I need to get frozen. I can feel, a little bit of sweat in the palms, some anxiety starting, and which is completely normal. What we try to do for patients to do that is initially, as soon as they sort of come up the elevator or come into the office, we just don't want our place to smell like a dental office. And so we use diffusers to limit that smell. Usually lemongrass, if you come in, that's probably what you're going to smell because everyone seems to like that one. In the back, we have TVs that give a distraction. So you can watch YouTube, Netflix. And we get a lot of times it's sort of the sound of the air or the sound of the drill that starts up getting you nervous. And so we have noise canceling headphones for that so that you can focus on your show and cut out some of the peripheral noise that's going on. A couple of the other things, making sure you've got a blanket in the chair so you're comfortable, and to make sure you're frozen before we start anything. The worst is getting some freezing and then the work starts and you're not actually quite frozen yet. And so for us, it's about testing that to make sure you're frozen before we do anything and giving you control. You're in charge. If at any point you need to stop, you raise your hand and we stop immediately to make sure that you're most comfortable in the chair and in the dental office.